The Poloni family chose Bupa Templestowe for their father Ernie because they wanted the best in dementia care.
Oh, it was a brand new building, so it looked lovely. Everything was, you know, shiny and new.
Our newest home has quality accommodation with beautiful interiors, relaxing community spaces and access to a unique model of care.
We thought, oh, Bupa, the brand, will have, you know, peace of mind.
But Vivian Poloni says Bupa Templestowe was nothing like the glossy ads. She was worried for her father, who was being cared for by people who seemed to have little understanding of dementia.
That dementia ward was horrendous, to put it lightly. So there were probably maybe 2 staff at most for about 35 people, and people that were needing high care, they were just left unattended. You know, they were just walking around, they'd be falling over, they'd be yelling out for help.
When auditors visited late last year, they deemed the home a serious risk to residents. But just a month later, Bupa Templestowe was given the all clear. That didn't convince the Poloni family, who put a hidden camera in Ernie's room earlier this year. Their camera captured these disturbing images.
It's just rough handling. It's not saying, oh, Ernie, I'm just going to take your, you know, your pyjama top off. It's just, you know, ripping it off or taking it off. It shows them not engaging at all with my dad. No communication, there's no care. It's just handling him and basically ignoring him, you know. There's no respect.
What is this, Ernie, early in the morning? We should stop giving you a shower then.
You know, he's a human being, but they're just treating him like something, you know, a piece of meat or something.
The family never lodged a complaint or made Bupa aware of the footage. Instead, they moved him into a new nursing home.
Dad's being cared for so much better, like the quality's fantastic and we're paying, you know, the same.
Australia's biggest private aged care provider, Bupa, is in crisis. The UK-based company runs 72 nursing homes across the country. Last financial year, more than half of them failed basic safety standards. Almost a third were deemed to be putting the health and safety of residents at serious risk. 13 have been sanctioned and lost government funding.
They've got this whole thing about, you know, person-centred care. If they had person-centred care, what's happening with Bupa now wouldn't be happening.
Lenny Downing worked at 3 Bupa nursing homes in her decade-long career. She dreaded working there.
I didn't want to go. You know that you're going to be short-staffed. Most of the carers are good. They're good people. They go above and beyond, but there's just not enough of us.
Lenny Downing says Bupa was also penny pinching when it came to the basics for residents.
Meals were disgraceful. Party pies, sausage rolls. They weren't supplying toothbrushes, toothpastes, pads. So they had like a 3-pad allocation.
Bupa is a giant global healthcare insurance company. It is technically a mutual company. It sort of doesn't have shareholders, but it functions and acts like a multinational corporation.
Jason Ward spent a year investigating private aged care companies like Bupa. Last year, the company received aged care subsidies totalling almost $460 million.
I mean, $460 million in 1 year is a lot of government funding for one company. And to continue to give them that kind of money when they've failed to prove that they can actually provide the care that is needed by elderly Australians, raises serious questions.
The Aged Care Minister Richard Colbeck declined to be interviewed for 7:30. But in a statement, he said the Health Department is holding weekly meetings with Bupa about its response to the failures. Last year, this shocking video at Bupa Seaforth in Sydney became public after a carer was convicted of assault. The aged care regulator launched its own investigation. This confidential report obtained by 7:30 details dozens of disturbing incidents involving residents with dementia, such as care recipients being assaulted by other care recipients, a male resident who undressed a female resident while she was crying on her bed, a female resident who was traumatised and fearful after being assaulted by two men.
The government has known about problems at Seaforth for over a year. They've had their funding cut, but this place is still operating, still open, and still supposedly caring for the residents that lived there.
Nikki Ashford moved into a new Bupa home at Echuca in Victoria in 2014.
So Mickey was the sweetest little man you'd ever meet. He was gorgeous.
The 55-year-old had early onset dementia and Down syndrome and had lost his independence.
The 21st weekend complained to her about his health, personal health and care, and then on the...
His sister Aileen spent a year complaining that Mickey was unwashed and uncared for, all due, she says, to poor staffing levels. And then this.
My sister went in and changed Mickey's top and noted and saw that his back was absolutely covered in this huge looked like a rash.
Mickey had contracted scabies, an infectious disease.
When you get a scabies, it starts off as a little, they might be two, and then they get under your skin and they crawl and they get bigger and bigger. So this tells the story that these have been there for a while.
Aileen Ashford went to senior management, which did an internal investigation. They denied her brother had scabies.
They weren't going to admit any liability or any wrongdoing because of the liability that would create for them as an organisation.
A year later, in March 2017, with Mickey in hospital close to death with pneumonia, the family discovered he again had scabies. The family had to wear protective gowns just to be near him.
Really, at this stage, I didn't care about Bupa. I just cared about Mickey. And so we took off the gowns and, you know, had human contact with him. I get a bit upset when I talk about it because he was dying. And really, we'd been through so much with Bupa that they were the last thought on our mind.
In March this year, the Echuca home failed 17 standards, including clinical and skin care. It was sanctioned and has lost its funding, yet it's still operating.
We would never go near Bupa again. They're not interested in people, they're interested in profit.
Despite the failure of so many Bupa homes across the country, advocates say closing them down would create an aged care crisis.
I don't think that they could lose accreditation because it would create such a tragic and terrible situation. It almost makes Bupa too big to fail. What do you do if 7,000 elderly residents who are in need of high care services are suddenly without a provider?
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.